I've already had COVID, I'm protected, and now the study says maybe even more protected than the vaccine alone. Should they also get the vaccine? How do you make the case to them?
You know, that's a really good point, Sanjay. I don't have a really firm answer for you on that.
That was Dr. Anthony Fauci, who has essentially become the man with the answers over the course of the pandemic. But when asked about natural immunity to COVID-19, that wasn't the case. Joining me now is a doctor who's been asking the same question, Dr. Hooman Noorchashm. He's a physician, immunologist, and public health advocate. Doc, it's great to have you. This has been one of my questions, too. It's why I wanted to get you on. So if you've had COVID, do you need a vaccine? That's the question here. And you say it's a key element that's been sort of overlooked here.
Well, absolutely. Look, here's the thing. I think Dr. Paul Offit said it best a few weeks ago in a public interview. The reason why we know this vaccine was going to be effective against COVID is that the natural infection itself, the virus itself, the immunity that the virus itself induces, it was actually effective at protecting against reinfection. And frankly, the CDC, the NIH, all the folks at Operation Warp Speed knew this. So this idea that now we're in the middle of a pandemic, we have about 80 to 100 million people who've been naturally infected, and now we're veering in the direction of these draconian mandates that require people who already are immune at risk of loss of employment and livelihoods to get force vaccinated. I think it really is a terrible sign of how far away the Biden administration is veering from the science.
Right. So
I'm all for immunity mandates.
What does the antibody test tell us, Doc? If you have antibodies, do you know how many antibodies you have or what the level is compared to what you'd have if you got the vaccine?
Look, the antibody test is sort of the serological gold standard for immunity. So, for example, in the past couple of years, I had the opportunity to go get credentialed at the Philadelphia VA hospital. I didn't have my vaccination record, so I went down to occupational health. They drew my antibody levels, and it was just really a binary answer. In reality, I think that the vast majority of naturally infected people, who've had the infection, are going to be protected, especially if they have the antibodies. Now, the levels can be worked out, but in truth, right now, the efficacy of the vaccine itself is veering somewhere between 10 to 30%. As we know, the mRNA vaccines are about 10% ineffective. J&J is about 30% ineffective. So you're talking about a 10 to 30% inefficacy rate. The natural infection is going to be at least as good as that. So really, I think the issue here is we got to encourage people to get vaccinated, and we got to encourage the Biden administration to not veer in the direction of forcing people at the cost of losing their livelihoods to get the vaccine if they're naturally immune.
So that's what I mean.
I do think there's a place for immunity mandates.
If you have tested positive and you have antibodies and you get the test to show that you have antibodies, is that something you can do if you're vaccine hesitant, you don't want to get it, and you think you've got enough antibodies as you would have if you've gotten the vaccine? Should you get the antibody test to know when, in fact, your antibodies are gone, so then you should get the vaccine?
Absolutely. I mean, in fact, that's what most European countries are doing right now. The European Parliament came out with their vaccine passport, criteria, and one of them is evidence of COVID recovery or evidence of antibodies. So really, this is a low virulency virus. The natural infection and convalescence from a natural infection does serve a very, very strong protective role. All the epidemiological data right now is pointing to the fact that level of immunity is at least as good as full vaccination in COVID-naive people. So really, fundamentally at the crux of this right now is, and some of the vaccine mistrust and hesitancy that's being caused has to do with the fact that the Biden administration is really pushing on this idea of mandated vaccination, especially in naturally immune people. I think this is really a destructive policy, and we got to sort of ratchet down on it a little bit and relieve people a little bit of the fears about losing their employment, educational opportunities, et cetera. Right. Really, the temperature's got to come down a little bit.
Because there are a lot of reasons for it, Doc, that's for sure. Hey, I don't know whether you saw, but in Florida, there was a chiropractor who was handing out waivers. As an immunologist, I'm wondering what you think of scenes like this where people are lining up to get a chiropractor to sign a waiver for them.
Well, I don't think that's necessarily appropriate. I don't want to disparage any of my colleagues in any branch of medicine, but look, I think it's reasonable if someone has had a COVID infection, has serological evidence of immunity, and they don't want to, get the vaccine for whatever personal reasons, not to have them be forced and to be coerced essentially into getting the vaccine at risk of loss of their employment. But I think there is some evidence that there's some marginal benefit to getting an added vaccination vaccination if you've been infected. And if people want to enjoy that benefit, they should feel free to do that. It just shouldn't be mandated. Certainly, I do think that if people are not immune, and especially in public engagement settings, it's in their best interest and in the best interest of our country for them to go ahead and get vaccinated.
Doc,
so I don't think immunity mandates are inappropriate.
I'm up against the clock, but I want to get you on this in just, if you can, 20 seconds. Why are we not, with the level of people vaccinated and the level of people who've been infected with COVID, not closer to herd immunity?
Look, I think we're pretty close. I think the reality is this virus is a low virulence virus, and I think that 90 to 95% is where we're going to see herd immunity. Now, a lot of the vaccinated folks, as you know, are not going to be fully immune, and you know, I think we have about 100 million people who have been naturally infected. So I think we're pretty close. But the one thing that we can do at this point is to start systematically screening the population. So I really would urge the FDA and the CDC and the Biden administration to adopt a policy of screening and making it liberally available to people to get screened for antibodies. This is an important piece of personal information.
It absolutely. I'm glad we were able to get you on, Dr. Hooman Noorchashm. Thanks for lending your voice to the program tonight. Appreciate it.
Thanks for having me, Joe.